Hi, my name is Souza. I am an endocrinologist working at Logan Health, Endocrinology and Infectious Disease. Very general term. I think when most people question the word metabolism, I think they are referring to the energy metabolism of the body, how the body regulates energy, intake, energy usage, and ultimately regulate body weight. Talking about our energy metabolism, our basic metabolic rate, which is part of our total energy expenditure. How much energy you spend every day in total. How many calories? Calories is a unit of energy, okay? So your total energy expenditure is divided pretty much in three parts, okay? One is your basic metabolic rate, how much energy you spend just to stay there and, your heart beating, your muscles breathing, your eyes blinking, that's the cost of it. Regulating your body temperature, okay, that all costs energy, okay? So that's your basic metabolic rate. The other part of that is your active metabolic rate. How much energy costs you when you are doing any form of activity, okay? And the other is that the caloric generation, the heat generation that occurs after we eat. Whenever we eat, that creates that food needs to be absorbed and metabolized, and that creates energy for consumption and expenditure, and that raises our body temperature a little bit, and that costs a little bit of energy, but that's a little bit, okay? So most of our daily energy expenditure comes from our basic metabolic rate. Not only as we age, but the part of life when we are spending the most amount of energy is when we are growing, right? So when you're growing, cells are replicating, bones are growing, children have incredible appetite and they're always moving. That's when your energy expenditure is the highest. Well, as we get older, that changes, and depending how, again, active you are, that will either decline like this or decline like that, okay? Again, it depends on your body composition. More fat tissue you have, lower is your metabolic rate, versus higher muscle mass you have, higher is your basic metabolic rate. There's a lot of metabolic disorders, okay? And depending what part of our metabolism you're talking about. You can say osteoporosis is a metabolic disorder of our calcium metabolism. Gout is a metabolic disorder of how our body regulates the uric acid metabolism, okay? Diabetes is a metabolic disorder of the carbohydrate metabolism, how our body metabolizes carbohydrates, okay? So again, when you come from the question, if the fundamental of your question is what leads to overweight, which I think that's a big question among the public everywhere, that's a little bit less clear. Yes, I think I have been talking about exercise. I think that's the only strategy that I can think that will improve your metabolic rate, okay? So by exercising, you are obviously you burning calories when you are exercising, and and it really doesn't matter what exercise you do, okay? I think both cardio, respiratory, like walking, is a great exercise, okay? There's pounding, there's good for your bones, it's costing you energy. Obviously it has also Mental health issues, I think when people are walking, exercising, I think they might disconnect a little bit of the daily problems. So I think that's the most effective way of improving your metabolism is by exercising. And I think your primary care physician should be, a great resource for you to utilize and ask that question. If there's more of a specific question, do I have diabetes? Again, I think your primary care doctor will be able to answer that question. When I think an endocrinologist or a specialist in a certain area of metabolism could then be involved if there are questions in terms of management or diagnostic challenges.